Obesity is one of the most serious public challenges nowadays in 21st century. So, by definition, if you want to know okay, what do you mean by obesity, then we have to check the basal metabolic index of the child, like BMI, which can be calculated with the help of weight of the child and height of the child. So, if we divide the weight in kg and height of the child in meter square, then we get a value. And if that value is more than 95th percentile or it is more than 30, then we call it an obesity. Most important cause of obesity nowadays is diet and lifestyle. Everybody know that, but nobody follows it. So what happens is that when the child is very small, when you start weaning in the case of the child, like you start giving food items other than the milk, at that time only what happens is that parents, because of pampering of the children, try to wean the children with the help of cream biscuits or chocolates, and they then get habituated to eating junk food. So the diet is the main cause of obesity. Munching on the junk calories like cold drinks, chips, kurkure, all these things can lead to obesity. Also, the second most reason is the lack of physical activity. Nowadays, all the sources of recreation which we used to have, like playing outdoor activities, jumping jacks, and all that has stopped. Now the children find recreation in screen time, like watching television, playing video games on their laptop and iPads. And while doing that, also they are munching some snacks. So this is leading to childhood obesity. Also in adolescent, if you'll see, there is a lot of stress going on. Some have, peer pressure stress, going to the college is stress, to excel in academic stress. So during all this stress now, they keep on studying also, but taking a lot of snacks. So that has got a sudden rise in the weight. When we see immediately after the exams, if the patients come to me, usually I notice there is a sudden rise in the weight of the child. And most of them are sleep deprived. So sleep deprivation can also lead to obesity. 1/3 of the obese children tend to become obese adults. First of all, this is documented with the help of various studies. And obesity is the main cause of heart problems later in adulthood. What happens is because of the obesity, there is a deposition of cholesterol in the arteries, which can lead to atherosclerosis, increase in the blood pressure. In the arteries of the brain, it can lead to stroke. And obesity can also lead to joint problems because the whole weight of the body is beared by the joints of the body, and it can lead to fatty liver, which we call steatotic liver. And obesity can also lead to breathing problems, difficulty sleeping, even sleep apneas, and other kind of neurological problems also sometimes are related to obesity. And the main thing which we are seeing particularly in adolescent children is that obesity causes a low self-esteem. Psychologically they feel that they should not interact with the other peers because of them mocking at their body shape, body shaming. So obesity can cause psychological problems as well. When the child starts to gain weight, the child starts becoming lethargic. If you ask them to perform the day-to-day activities also, they'll be very reluctant to do that because they have to bear the weight of their body. And the lungs also react similarly. They have breathing difficulties, and they have difficulty, climbing stairs, doing mild chores of the daily life, and they have shortness of breath. Also, they may feel a pot belly, and some of the children also have poor growth. So if we talk about how much exercise a child requires, if we consider children who are less than 5 years old, you will always see that they do not sit at a particular place. They keep on running, walking, doing one thing or another. So for those children, we are not worried at all. But the children who are more than 5 years, who develop a taste towards junk food, and they are mostly sedentary in their day-to-day life, they require to work to do some physical activity in the form of either exercises, or they can join some games like volleyball, football, and they can do some badminton. So whatever activity they like, even dancing, at least 60 minutes in 24 hours, this kind of physical activity is must. Also, apart from aerobics, they should be slight motivated to do strength training, because fit muscles leads to fitness and a fit body. Parents should inculcate a good feeding habits in the children. So good food habits include a kind of a balanced diet which contain all the nutrients, carbohydrates, fats, vitamins, minerals, and proteins. So if you talk about carbs, usually the children should avoid refined carbs like maida, which is there. Nowadays they eat a lot of bread or Maggi, and they should shift to whole grains like we have oats, ragi, and that diet of the children should have a lot of proteins. Proteins are very essential nutrient which is required for the growth of the children. So if we take non-veg, then the eggs, lean meat is the alternative. And for the vegetarians, it is legumes, beans, nuts, lot of dairy products they should take, because not only they have proteins but have a lot of calcium and vitamins which are required for the body growth. And apart from the diet, they should also take a lot of water, because water plays a major role in keeping your body fit. And the fiber should also be included, so that for the smooth bowel, and they do not suffer from constipation and all that. Obesity is a lifestyle problem. There is no particular cure for obesity. So as I told before also, that it is best to prevent obesity, like by modification of your lifestyles. That is the introduction of at least 60 minutes of exercise or physical training in a day, and refuse to be a sedentary. And also the diet plan should be such that it avoids the junk calories. That way you can keep your child healthy and fit. But if if your child is obese, then child will require some medicines which are used nowadays, and some surgical options are also there if the obesity is life threatening. Low metabolism means that a sedentary lifestyle. First of all, low metabolism, to increase your metabolic rate, you should have a lot of exercise. You should do a lot of exercises, and there are some diseases also which leads to low metabolism. Like we have hypothyroidism, in which your metabolic rate decreases because of the lack of the thyroid hormones. In that cases also, there is an increased chances of obesity. There is proven studies which prove that genetics play a major role, and usually we have seen that obese parents have obese children, and they have to be very cautious, because as I told you, this kind of obesities which have genetic predisposition to being overweight, can have a genetic predisposition to the other related diseases which are related to obesity, that is the heart diseases, diabetes, blood pressure. That also they are associated with the obesity only.